everybody. Thank you for joining us here today. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation. And for many months now, we've been doing a Facebook Live twice a week, Mondays and Fridays, 1 p.m. Eastern Time, addressing parents' concerns during this very difficult time we were living in. And we're bringing experts from all over Canada to address the parents' concerns. And we also bring in topics that are relevant to healthcare professionals. So you can watch previous sessions on our website, which is canadianpremis.org, and that is under COVID-19. There's a lot of resources there and a lot of experts addressing breastfeeding and mental health and how to support families in an ICU at this time. There's a lot of content there that you can watch us. And today it is the last day of World Breastfeeding Week. And this week is organized by the World Alliance for Breastfeeding Action. And this year's theme is support breastfeeding for a healthier planet. So we're going to talk about that and also how to meet your breastfeeding goals and supporting the parents who are breastfeeding or pumping in the NICU. And I have here with me Maxine Scringer-Wilkes, who is a nurse, and she was a public health nurse in Calgary for 13 years, where providing a face-to-face contact with new families soon after discharge is a standard of care. During her time in public health, she observed feeding challenge to be a major concern for most families. She became passionate about lactation support and attained the International Board Certified Lactation Consultant designation. Maxine noticed many mothers with preterm infants discharged from the NICU with the intention to breastfeed. In 2016, she made the transition to working at the Alberta Children's Hospital, where she works primarily in the NICU. Maxine, thank you so much for joining us here today.
Thank you so much, Fabiana, for the introduction. Thank you so much also for inviting me to talk today.
That is great to have you here. Maxine, why is so important to recognize the Breastfeeding Week and raise awareness about breastfeeding?
Well, it's really important to raise awareness because we know that breastfeeding has been recommended by the World Health Organization, also the Canadian Pediatric Society, and other government bodies around the world. And they recognize the importance of it for maternal and child health. So they encourage and recommend breastfeeding for the first 6 months of an infant's life, and then to introduce age-appropriate solids, and to carry on breastfeeding for up to 2 years and beyond. We also know that many places, moms and infants are not able to reach those recommendations, whether it is through exclusivity, whether it's through duration. So in Canada here, we do have a high initiation rate. However, it does drop off quite soon. And so we do value any amount of breastfeeding that a mom can do, because moms and babies will have the importance of breastfeeding conferred to their health. So for a mother, her health, when she does breastfeed, different things, the importance for her health is, for instance, a decreased risk of breast cancer and also uterine cancer. Moms also do have decreased risk of cardiovascular disease. And there's not too many things that you can do in your lifetime at a certain point that can decrease your risk for breast cancer. And the research is very definite in those outcomes for women. As well as diabetes is very big. And also for women of color, you know, we have higher rates of diabetes and cardiovascular disease, strokes, heart attacks. And so if you are able to breastfeed, you can decrease your risk substantially. And also there's the importance for child health as well. So we know the respiratory health of a child who breastfeeds is improved. And another really big one, especially in the NICU, is the neurodevelopmental outcomes and improvements that can be seen really early on MRIs for an infant that is exclusively breastfed compared to one that is mixed fed, and then one that is not breastfed at all or receives no breast milk. So the health for an infant is really different and improved when they do receive breast milk. The other concern too for infants is, you know, there is some evidence about decreased asthma, which is related to the respiratory health, ear infections as well. Also, their immunities are improved when they receive mom's milk. Mom's milk is always changing as well. The body knows, it knows that has grown a baby, and it knows its job now in the 4th trimester is to breastfeed. And so there's breast changes that go on during pregnancy. The body knows that she's had a boy baby, will make milk for a boy baby or a girl baby. And also the body also knows that it's morning and will make milk in the morning that's different from nighttime milk. The breast milk composition does also change throughout a feeding. So, you know, in the beginning of the feed, it's different than the end of the feed, the higher fat content at the end of the feed. And so there's just different risks like that. And so I also want to just tie it back to the importance of our health, population health. So it's important for population health and public health outcomes when we do support mothers and babies, or they're able to breastfeed to these recommendations. And we do see less hospitalizations for infants who breastfeed, and as well as for the health of mothers who are able to breastfeed. So this year as well, I wanted to actually start off with the WABA and what they have put as their 4 priorities or objectives for World Breastfeeding Week for 2020. So the first is to inform. So WABA really wants to inform and tell all people about the links between breastfeeding and also the environment and climate change. So when women are breastfeed, there is no waste. It is just fresh, the right temperature at the right time. And I always tell moms as well that when baby feeds effectively, they're ordering for the next meal. Or if you pump well, you're establishing and maintaining your milk supply for the NICU moms. To anchor, so breastfeeding is a climate smart decision. Really, it's smart as well because moms who breastfeed, there's also money left to feed the rest of your family and to feed yourself. So it's also that smart decision. And we also want to engage individuals and organizations for a greater impact. And so for women too, it is not just on their shoulders to breastfeed, it's all the whole community around them, whether it's their own mother, their sisters, the organization that they're in, the facility, support people like myself, the support of her partner, the support of the doctors around her and other healthcare providers is very important. And then to galvanize is their final objective, and that is to improving the health of the planet and people when they breastfeed. So those are the 4 objectives of WABA for this year's breastfeeding, and it is to sustain our planet and just the planet.
That is great, Maxine. Thank you so much for shining a light on this and to really make us understand the importance of it. And this week, we really talk about how important breast milk is for preterm babies. We know that it's more than food, it's also medicine for those babies. But as you mentioned, moms in the NICU have to pump if the baby is born extremely preterm. And it's not always easy, especially in the beginning when mom is recovering from the delivery or had a complicated pregnancy. How can we best support the moms who are going to be pumping sometimes for months in a row?
Right. So the best way we can support moms is to see them really early on. So breast milk in the first 3 days postpartum is when we can really set those milk receptors high so that moms then will not have a worry later on of a decreasing or not really establishing a really good milk supply. So in our NICU at Alberta Children's Hospital, we are not a hospital that does births. And so the moms are often in another facility. So sometimes I'll speak to the dad at the bedside and just see how things are going with the moms. Sometimes I will phone the moms and just ask how they're doing, if they're able to start hand expression. I'll ask them to see if they can talk to the lactation consultant there. I may even coach her over the phone on how to hand express. And so women who hand express early in the first 3 days always make more milk. And there's many studies done on that, those outcomes of milk supply and really hand expressing early. So the women who are long-term pumpers, there's a few tips and tricks that help them to go the distance when they've got to pump for 2 or 3 months. And that just sort of make things easier for them. So such as, having a pumping bra. That just kind of makes it hands-free so that they don't feel so trapped. So I ensure that they know about a pumping bra that can help them. But before even that, when their milk starts coming in, having the right equipment and ensuring that it fits them well. So there's different sizes of personal breast shields that really makes a difference on mom's comfort. And if she's not feeling comfortable, she won't want to do it. She's going to sustain some injury to her breast, and no one wants to do that. So I really get in early and work with her, see how she's feeling with pumping, see if she's got any concerns with her breasts. And if she does, we address those. Because comfort, if you've got to do an action or something 6 to 8 times a day, you've got to look forward to it and not dread it. And especially something as important as providing milk for your baby. So that's a little something that I really like to check on, because it can impact the way the milk is coming out of the breast. And then I coach her on massaging breasts as well. And then also having an app really helps. So there's some free apps there that moms can actually chart how much milk they're removing, they're expressing from their breasts. And then some of those apps will graph it. You can set an alarm as to wake you up to the next pumping session. And so those things are important as well. So nutrition wise, I just tell moms to eat what they enjoy, have a colorful diet, get rest. If you're not resting well, that does impact your milk supply. I do ask them to pump once in the middle of the night between midnight and 6 a.m. And sometimes their breasts are waking them up anyway. So I tell them to get up, pee and pump, and maybe have a glass of water as well. And then the milk flows really well when you're well hydrated. And also get a good amount of sleep at night, because the days are full. The days are very busy and stressful at the NICU, and they're worried about their child, and so rightfully so, but we want them to be able to handle that busy day and all the information that's coming to them. So yes, pumping is about protecting the supply, building it until such time as if the baby is able to come to the mom's breast. Perhaps if not, baby can still have breast milk. And so that is, what we do with the pumping.
Yeah, some of the tips that Maxine is giving is going to be on link on the comments below. And we also want to share with you that we do have a podcast for pumping moms. It's a 15-minute long podcast, and parents can just listen while they're pumping. We bring a variety of topics, and we also have 4 podcasts on mindfulness. So just relax the mom and try to relax the mind while you're pumping, because it is hard work. Maxine, a question for you about the colostrum, because in the very beginning, this is all we have, but this is the liquid gold. But how much babies really need at that point?
So colostrum is made in the breast between 12 to 16 weeks. And so it's being made as the baby's growing. So the body kind of knows. Infants are born with a very permeable gut, and there's sort of spaces and gaps in there. So it's an immature gut. And colostrum is just an amazing first food for the infant gut. It's quite sticky and thick. And so for that reason, it doesn't run right through. It just paints the gut lining and helps the permeability. It seals off the gut. It also has SIGA, which is actually is like the first immunization to the baby to protect the gut. And so colostrum is made in very small quantities. Actually, the average mom makes about 37 mLs in the first 24 hours. And you know what? It's enough for her baby. So she's grown, most women grow, and even the NICU moms, you've grown a baby without any milk. And so when they're born, they don't need a whole lot of milk at the beginning, but they need some. And so it's in the first day, it might be 2 to 5 to 7, depending, mLs each time. And this is the size of a baby's gut when they're first born. And this is a full-term baby, the size of a marble. So how much milk can that take? So it's just a small amount of milk. And so 37 mLs is just a little bigger than this little container med cup that I'm holding. And that's over the first 24 hours. So knowing how to move the colostrum through the breasts is really important. And so doing hand expression really pushes that sticky first milk through the breast. It sort of primes the breast and helps the mature milk to run really well after. Like I mentioned a little before, the women who know how to hand express always make more milk. And so I also incorporate hand expressing into pumping. You know, we are a really resource rich unit that I work on. Each room has its own pump, and we're blessed, and it's wonderful. I think it's great. But knowing how to hand express, if you're in a pinch, you can hand express anywhere. You just need a clean container. And so it's moving that milk so that more will be produced. If you don't move it, you'll lose your supply. So if they're stuck in a traffic jam and it's been 4 hours, perhaps she's got an empty coffee cup, she can just, you know, we've all got hand sanitizer in our cars now, so hand sanitize and then hand express, because you're stuck, you know, in the state of an emergency as well. You grab your purse, grab your baby, and you run. And you've got milk and a spoon and a clean cup, you can always feed your baby. If we had a power outage, she can hand express and have milk for the next feed. So I think in a state of emergency as well, breast milk is always available, and it's great for the baby's health. Other things about colostrum is, you know, it's high in beta carotene. That's where it has that beautiful golden color. We know that it's the baby's first immunization, and that's what we feed first to the babies in the NICU. When they do start to eat, we give them their mom's colostrum.
So Maxine, talk about containers. We had to talk a little bit about containers before this Facebook Live, because during the pandemic, you know, we know now that even if the mom is COVID positive, the virus doesn't go on the breast milk. But how about the containers? Is there a fear the container might be contaminated? And what is happening now in that situation?
Right, right. So, you know, with COVID, there was new information coming out on the daily, and Habama put out some information about handling of the milk containers. And so currently what we are recommending, of course, is for moms to pump in the container if they're not able to direct breastfeed, so that the baby can receive the important properties of breast milk. So, of course, before pumping, moms need to do hand hygiene, wash their hands well, wash their pump parts kit very well. Also, you know, there is some pumping, although if a mom is not coughing, that may not be necessary. So the current guidelines is for a nurse to wipe the container before putting it in a storage. If, however, the mother has her own fridge in the room with the baby, if she puts it in the fridge that she's using and only she is touching, then, you know, she can still wipe it and put it in there. But good hand hygiene is very good. If it's a shared fridge, then you wipe the container. One nurse will hand it to the next nurse standing outside the door. That nurse that takes the container will wipe it down and then put it in a basket with the infant's label on. And the milk is always labeled with the infant's identification label and also the time and date of pumping. And it's put in, if it needs to be put in a fridge where they're all shared, as what at the Children's Hospital, that's the setup we have currently.
Okay, that is great information. Maxine, we also have a lot of questions sometimes for parents that, you know, once the breastfeed is established in the NICU or bottle feed, it's time to go home now. Baby, let's say baby's in full oral feeds. And how do we prepare that transition from the NICU going home and to still keep a certain schedule or mom's goals on breastfeeding or feeding their baby?
Right. So we're very fortunate at Alberta Children's Hospital that we have single parent rooms and single baby rooms. So the rooms have a bed in as well, so that the moms can stay the night. So many are encouraged to stay anytime they want to along the journey of the child's admission. That way they do know their child and they feel more positive and also more confident in going home because they are present to see those feeding cues. They're present to do more skin to skin, which is amazing for moms and dads to do. The skin to skin also helps mom's milk production, and moms who pump right after skin to skin get more milk, and it just really helps moms as well whose milk supply might be declining. But having said that, we tend to have babies start to feed as normal newborn because they start to wake up and show feeding cues before the 3-hour mark. And so we know that babies who feed when they're showing cues and are ready to feed are more likely to feed better. It's more relaxed for mom and baby, just a really nice calm feed. The baby takes what they want and how much they want. When they're ready to feed, they come off content and satisfied, and they sleep and grow, and all is happy. So, so moms that are staying with their baby in preparation of going home, they're just more prepared. They know their child, it's their baby, and they feel, you know, ready to go home. So we really move it to cue-based feeding and responding to the child's cues, whether they are breastfeeding or bottle feeding.
So that continues at home, because my next question to you was like, when do we drop the hospital schedule when you go home? But if you already start in the hospital with the cue feeding, you just continue at home. Is that?
That's right. And that is the goal, is for them to be present and to be working and feeding the baby. And then they know the baby's cues. They know that, you know, sometimes the baby will cue, not wait till 3 hours. The baby's hungry. It's sort of like us too. We don't eat just right on schedule, and we would probably enjoy our food if we're ready to eat it, and we take as much or as little as we want at that time. You know, these NICU babies too, yes, we want them to grow and we want them to thrive, and it's very important that they take certain volumes to meet their growth and developmental milestones. And so sometimes they go home with fortified bottles because they need it for their bone growth, etc. So I work as a part of a multidisciplinary team. We have an excellent dietitian, occupational therapists, speech language workers as well. So, and then the neonatologists and the nurses, we all work together, and just watching the baby's cues, and as they move from NG feeds to starting to take the breast or the bottle, and there's a time and an amount that they start to, when they master that and solidify those skills, they've built a really nice strong foundation, and then they can move up to the next level as they master that, and then are consistent as well, and then they move up to the next level. And that's a really good program that we follow at the NICU. It's called SYNC, and it's very good, and it works so well for the infants, and the mothers like it, and then they just kind of keep on building their skills and then are ready for home.
That is wonderful, Maxine. But now when you're home, you lose the team. We lose all the multidisciplinary team, and we feel, okay, we are home now. I'm alone. Now there is a pandemic. Maybe parents don't feel as comfortable getting out of the house to go to their doctor's appointment. We know that a lot of appointments are online right now. But when parents should be concerned about gaining weight or mom's milk supply, when do they look for help, and when is the point that they should actually be concerned about something?
So I always tell parents they know their baby better than anyone else. So if there's anything happening at all that you just are not comfortable with, you don't like, your baby is not eating, you know, 2 feeds of not eating, call your doctor for help. You can call the early start line that we have in Calgary. They're excellent. You can come back to the Children's Hospital, bring your baby in for an assessment. You know, if they have a fever, if their output, they're not peeing and pooing, you know, their color isn't good. But if you use your gut reaction, and if you've been through them at the NICU, you know when there's something just doesn't sit right, bring them in. You're never wrong as parents, because you know your child better than anyone else. You've been there consistently throughout the entire journey. But yes, we do look for babies to gain, you know, 20 to 30 grams for the first 3 to 4 months. So you can take them into the public health clinic to have them weighed, you know, once every 2 weeks, 10 days. You can, you know, public health in Calgary is awesome as well. They follow the babies as well. Neonatal transitional care team follows as well. But if your baby's not taking in the volumes They're not having wet and dirty diapers like they should, 6 or more heavy wets, at least 2 poops in 24 hours. Take them in. It's always to be cautious with a new baby. We want them to do well. So
Absolutely.
mm-hmm.
Yeah, and as you know, parents do know best after so many months in the ICU, and obviously every province has its own resources, and I think it's safe to always consult your doctor, your physician in your province to know what are the best options and what is available at this time. Uh, you talked to me about something that I really loved in our chat was mothering the mother, because I think the mother or the parent is not always looking after themselves after the ICU, because now I have this baby who needs so much attention, but we cannot forget mom and dad or the other parent that is always there, and we need to eat, sleep, drink. So how do you take care of that parent, Maxine? What do we need to do?
Well, I think, yes, the mother can sometimes get lost in all of this. And sometimes moms have said I'm looked at as just the milk deliverer. But, moms are the heart of the home. Often I've heard that. And so moms do need TLC and some self-care. And so often they just kind of need someone to sort of tell them what a day might look like. And often I say to our NICU moms, yes, it's like a job right now. You come in the morning, you get sort of report on how your baby's night went. If we didn't already get up and call during the night to find out what's happening, or you were phoned, but you check in and you say good morning with your baby. You may do some skin to skin, or you may pump. Then you'll hear what the rounds have to say, what the plans are for the baby, and you go for a coffee break. Come back, perhaps maybe you'll go out for lunch, meet a girlfriend for lunch, and just talk about normal everyday girl stuff with her. In the afternoon, you may check back in and do some more skin to skin, do a feed or a few feeds through the day. Oftentimes moms in the earliest time is just starting to get to know how to hold her baby and do some nuzzling. And that's really just lovely for moms and babies, because that builds her confidence. And really, I'm going with the mom's goals and what she wants to do. And so I'm just, often I just say I'm a cheerleading her on and walking with her. But so that's kind of how I tell them to do their day. But moms do need permission sometimes to just go take a break and, have a good night's sleep. And, pumping is important, but your milk supply will be affected if you're exhausted. So, I do say in the early days, it's important for you to recover. Many moms have C-sections with these premature babies. And so we forget that that is major surgery and they need to recover. Their body's trying to fight and recover from this big surgery. And sometimes they have postpartum infection. They've had a major bleed. That takes time for their body to recuperate. So I'm honest. I give them permission to, just sleep tonight, and tomorrow's a new day. And please look after yourself. I think it's great when they've got a mother-in-law or they've got their own mother that's bringing them food, a sandwich, a smoothie. The husband is bringing them snacks as well, giving them a massage, washing the pump parts. They're in it together, but the mom, yes, I think she really does need mothering so that she can have the energy on board, because later reality, it's going to be mostly her.
Absolutely. This is so important. Thank you for bringing that up. And, this week we talk a lot about breastfeeding. We raise awareness about breastfeeding, but we also got message from a lot of moms who are not able to breastfeed or produce any milk for whatever reason it is. We are not here to judge any moms, and you often see moms who have to use a G-tube on the baby or a bottle feed. And Maxine, I wanted to give a message to these moms, because as a mom, I think being part of a mom comes with guilt, but there is an extra layer of guilt when we hear so much and seems to be so much pressure on breastfeeding, and some moms just cannot or choose not to. So what is your message for those moms?
My message for every mom is that, we're all here to do the best that we can be. And for you to be the best mom that you can be, we're just here to support you in whatever decisions you make. You know your journey and you know your reasons, and we just want you to feel comfortable, and we support whatever decision you make, and we all are here just to be the best we can be. So that's what I tell moms. I have the knowledge to help you do whatever you want to do, and I'm just here to support you.
Absolutely. Maxine, this is so beautiful. Thank you. And thank you so much for your time and sharing your knowledge here with us today. And I hope we can come back another time to talk about other things of breastfeeding, because it's a very wide topic.
I'd love to. Thank you very much for having me.
Thank you. So for everyone watching us at home or in hospital, thank you so much for watching us and for being with us during this pandemic. We will continue to host Facebook Live, and in August, I will be hosting every Friday, 1 p.m. Eastern Time. And every Wednesday, Kate Robson, who is a therapist and also a mom of two preemie girls, is hosting a real-time peer support group here on Facebook. And to join her group, you can join the Canadian Preemie Parent Support Network. It's every Wednesday, 1 p.m. Eastern Time. And thank you so much for being with us this World Breastfeeding Week. I think we learned a lot more about breastfeeding and the importance for our babies. So I see you all next time. Thank you.